Hello everyone, welcome back to 3 News Now. It's Friday, August 7th, and we are staring right at the weekend. I'm Stephanie Haney. This is your afternoon update from the top headlines from WKYC.com and our WKYC app. The things we're going to cover for you today are the updates from Governor Mike DeWine's press conference, as well as more positive COVID-19 tests related to President Donald Trump's trip here to Ohio yesterday with those rapid tests, what happened in Bratenahl. Also, we'll give you the latest numbers on COVID-19 here in Ohio from the Ohio Department of Health. We will give a mental health check-in, and we'll look at tips from a Cleveland Clinic expert on how to handle the emotional roller coaster of the COVID-19 pandemic that we are all dealing with right now, and let you know how Cleveland Cavaliers owner Dan Gilbert became the second richest NBA team owner, literally today. That happened today for Dan Gilbert. Congratulations to him. We'll be talking about that at the end of the show today. Okay, first up, from Ohio Governor Mike DeWine's press conference today, we knew that we were probably going to hear something about sports, but he did kind of push it off to next week. We expect new guidance about sports in Ohio next week. That is what DeWine said at his press conference today. This will cover professional sports, high school and junior high sports next week, also college sports. DeWine did acknowledge that people are concerned right now about the possibility of a fall sports season, but he did say that administrators are doing everything they can to make a season safely happen. We do know that under Ohio Department of Health orders from last week, there cannot be fans in the stands at contact sporting events. So that includes professional football, that includes college football. And we do know that the Cleveland Browns and the Cincinnati Bengals have submitted proposals to the state to have fans in their stadiums. So it will be very interesting to see what Governor Mike DeWine comes back with next week when he has additional guidance for us related to sports here in the state of Ohio. Now, as we know, Governor Mike DeWine had a very roller coaster of a day himself yesterday, because when President Donald Trump arrived here in Cleveland, Governor Mike DeWine intended to greet him, so he had one of those rapid COVID-19 tests and he tested positive. Later in the day, he had another test, a PRC test, down at the Wexner Medical Center at Ohio State University, and he tested negative. They ran those tests twice, came back negative both times, so Governor Mike DeWine is negative for COVID-19, but 6 employees at the SHOREBY Club, which is where President Donald Trump had his fundraiser yesterday evening, tested positive for COVID-19 with those rapid tests. The club manager at Bratenahl's SHOREBY Club said that the 6 employees were not allowed to work Thursday, and they are now in quarantine. Also, a club member told 3 News that the facility was not taking lunch reservations yesterday, and another member said that the pool and the gym are closed right now. In an email to members, the manager said, "We're arranging for the employees who tested positive. All 6 of those employees," the manager says, "are asymptomatic, by the way, but they are being arranged to be retested with the hope that they also had a false positive from the COVID-19 rapid test, similar to Governor Mike DeWine yesterday." The club's manager said to rest assured that the club is taking care of the employees, and they will be arranging for that follow-up test so they can hopefully get more information related to those potential COVID-19 cases, which have tested positive at this time, according to the rapid test. Now let's take a look at the COVID-19 numbers here in the state of Ohio. And do keep in mind when we're looking at these tests, when we're talking about tests and the reliability of them, Governor Mike DeWine did say that Ohio is not widely using the rapid COVID-19 tests. They are using the PRC test. It's been done more than 1.6 million times here in the state of Ohio. That's according to Governor Mike DeWine yesterday. So when we look at the new numbers that are out from the Ohio Department of Health today, we see that new daily reported cases are up. New daily reported deaths are up, but we do see a drop in both new and current hospitalizations. The number of new reported cases in the last 24 hours is 1,204, which brings our total number of COVID-19 cases that we've seen here in the state of Ohio to now 98,765. So if we continue at this rate, we will possibly see that number breaching 100,000 tomorrow or the next day. Now, the Ohio Department of Health did confirm to me that numbers that are daily reported do tend to be lower on the weekends because not all of the labs are open and the hospitals are not reporting as frequently on the weekends. So keep that in mind when you take a look at those new daily cases and daily deaths and hospitalizations and all of that information that comes in over the weekend. Our daily testing positivity rate is at 5.1%. We are just above that recommended World Health Organization threshold of 5%, and our 7-day rolling average is at 5.4%. So this means for all of the COVID-19 testing that we're doing, these are the percentage of tests that are coming back positive. In the last 24 hours, there have been 34 new reported deaths, which brings that total number of deaths here in Ohio to now 3,652 related to COVID-19. And we saw 81 new hospitalizations, which is down quite a bit from yesterday. Yesterday, we saw 145 new hospitalizations here in Ohio. Today, 81 new hospitalizations, bringing that total number now to 11,447 people who have been hospitalized. The number of people who are in the hospital right now is 956. So when we look at the people who have been newly admitted to the hospital in the last 24 hours, and then we take into account people who have been discharged from the hospital, we have a net decrease. There are 23 less people in the hospital today than there were yesterday. The total number of people who are in the ICU is 334. That's also down from yesterday. There are 8 less people in the ICU today than there were yesterday. And that's just under 35% of all the people who are in the hospital are in the intensive care unit getting treatment in an ICU. We have seen 14 new ICU cases reported in the last 24 hours, and that brings the total number of people who have had treatment in the ICU related to COVID-19 to now 2,641. And when we look at hospital bed occupancy, statewide we are at 73%, which means that 27% of hospital beds are available for people who are suffering from COVID-19 or other things. Now let's take a look at the national and the global numbers. These numbers come from Johns Hopkins University. The U.S. is getting very close to 5 million reported cases of COVID-19, and globally we are now over 19 million cases of COVID-19. There are now 4,902,692 reported cases of COVID-19 in the U.S. and a total of 160,394 reported deaths. That's a 3.3% death rate when you compare deaths to the number of known cases of COVID-19 in the U.S. Now the U.S., which has 4.25% of the U.S.'s total population, of the world's total population, has 26% of the world's known cases of COVID-19 and 22.4% of the world's known deaths related to COVID-19. The total number of cases of COVID-19 globally is now 19,172,505, and the total number of deaths related to COVID-19 globally is 716,327. That's another big jump from yesterday. Yesterday we saw almost 8,000 new reported deaths. Today we're seeing another big number of new reported deaths globally. It's about 6,200 new reported deaths globally. So yes, less than yesterday, but still a high number compared to what we have been seeing globally in terms of new deaths. Now, as we're all dealing with COVID-19, of course, mental health is a major factor. The Cleveland Clinic has released a list of tips to deal with this COVID-19 emotional roller coaster. And I'm sure I can tell you personally, some days it's fine. Some days I'm very stressed out with the isolation and those kinds of things. And if I'm feeling that way, I'm sure lots of you are feeling that way too. So the clinic says one of the first things that we can do is just understand that lots of people are experiencing the stress, and understand that the stress is present. Doesn't mean that there's anything wrong with you, that the stress is a factor of what we're dealing with in our lives today, and know that the ups and downs are an inevitable part of the solution which we are working towards to figure out how to handle this COVID-19 situation. The Cleveland Clinic says to focus on staying mindful and in the moment, and we don't know how long this is going to last. This comes from psychologist Dr. Susan Albers. So the best thing to do is focus on today. Dr. Albers says we can't control what's going to happen in the next month or several months down the line, but really focusing mindset on today, focusing on what I can do today, will help you to stay present and not forecast and not add to the stress that you're already experiencing on a day-to-day basis by looking to the future and considering what those stresses might be. Other simple tips from the Cleveland Clinic. Get outside when you can. It is great for your mental health as well as your physical health. Also, monitor how you consume the news. The clinic does not recommend consuming the news, particularly related to COVID-19, right before bed or first thing in the morning. Now, that is particularly convenient advice for this show. Maybe you consider a noon or a 3 p.m. daily update with 3 News Now. Hint, hint. But seriously, consuming news related to COVID-19 according to the clinic right before bed and first thing in the morning may be something you might want to avoid if that's a particular stress for you. Also, look for the positives and avoid things that make you feel worse. And first and foremost, never be afraid to ask for help. We do have resources on WKYC.com if you feel like you need support for mental health. Also, if you go to coronavirus.ohio.gov, there are mental health resources there from the state of Ohio. That's something that Governor Mike DeWine has made it a point to offer to Ohioans, is mental health support as we all deal with this pandemic. I'll tell you one Cleveland person who's doing pretty well today is Cleveland Cavaliers owner Dan Gilbert. His net worth just increased by $34 billion, and that makes him the second richest NBA team owner out there. Now, this is on paper. We'll tell you how. Dan Gilbert took his business, Rocket Companies, public on the New York Stock Exchange today, and that increased his net worth by $34 billion when people bought shares in Rocket Companies. He's now worth just over $41 billion. So how about that for a raise? He went from being worth about $7 billion, according to Forbes, to now $41 billion, according to Forbes. Not a bad Thursday for Dan Gilbert. So, who's richer? Who is the number one wealthy NBA team owner? That goes to Los Angeles Clippers chairperson Steve Ballmer by a lot. His estimated net worth is over $73 billion. That is a lot of money. They are doing very well for themselves. So congratulations to Dan Gilbert on taking Rocket Companies public and now becoming the second richest NBA team owner in professional basketball. That's it for your 3 News Now afternoon update for Friday, August 7th. I will see you at 5 p.m. on What's New, which you can stream in the WKYC app. So if you don't have that app, make sure you download it. That's also where you can send us photos and videos that we might use on the air. So keep that in mind as well. You can do that with the Near Me feature on the WKYC app. And then I'll see you back here on Monday with your 3 News Now early update. Everyone have a nice rest of your afternoon. I'll see you at 5 on What's New, and have a great weekend. I'm Stephanie Haney.